Hello everyone. If you have a senior citizen, an elderly person in your home, this video is for you. Listen to me carefully. Today I am going to talk about slip and fall in elderly and hip fractures. Why is it so important? You may think it's just a slip and fall, what would have even happened? But these hip fractures can be life threatening and you would be losing one of your senior elderly person. So, I am Dr. Amardeep from Shivam Advanced Ortho Care Hospital, Basveshwar Nagar, and today I'll explain you why these hip fractures happen with a minor injury in elderly and what is the seriousness of this hip fracture and what will happen if you have not delayed the treatment in this, and also what are all the treatment options. So, let's dive into it. What is a hip fracture? See, there is a typical scenario. I have just operated a patient on that also yesterday. They just while walking to the bathroom, they slipped and fell off and they have a hip fracture now. So why this hip fracture occurs with those minor injuries? But the same if you see in a young patient, to have a hip fracture, he should have a high velocity injury. That much thick and strong bone it is actually. But the moment he goes to being elderly of more than 60 years, they just cracks. The moment he slips just in the bathroom or one step missed in the stairs, he will have a fracture. This is called osteoporosis, wherein the bones will get porosed over a years due to age, and it will be neglected because it is a silent killer. It won't come to you with the symptoms, but the moment there is a slip and fall, after the fracture you would get to know that he was suffering from osteoporosis. So that is the major reason for the hip fractures to happen. Now the hip fractures have happened. How do I know at home there is a fall, and now how do I know at home that my grandmother has a hip fracture? So what are the signs of a hip fracture? So hip fracture, one thing is the fractured limb, he won't be unable to move, he'll be in severe pain. Other than that, the fractured limb will look shorter than the normal limb. Other than that, you will have that fractured limb will be rotated outwards than the normal limb, and also there will be swelling and bruising all over the hip region. If you have all these things, and the elderly won't be able to even get up and walk. If you have all these signs, then certainly it is a hip fracture and you have to rush to the hospital as soon as possible. Now, why the hip fracture is dangerous? It's the fracture, it should be operated and fixed. What is there in that? Why is it so life threatening? See, the moment there is a hip fracture, your time starts ticking. The time of death starts ticking, and the first 48 hours is the utmost important time for us to intervene in these cases. So what happens is there is a deadly combination of the patient going into a bed. The moment there is no movement and there is no deep breathing, what happens in the elderly is the lungs starts accumulating the secretions, and when there is a secretions get accumulated, they'll end up in pneumonia just within 2 days. And also not that once the movement is delayed, the blood starts clotting in the elderly in their limbs, and those blood clots can flush into the blood and go into any part of the region and cause blood clots. If it goes to brain, they'll end up in stroke. If it goes to heart, they'll end up in heart attack, and if it goes to lungs, they'll go into pulmonary infarct. That is a very life threatening condition which can happen if you not operate those patient at the right time. So wherever there is something called heart attack, we also have something called hip attack. The moment there is a hip fracture in elderly, we have to intervene like a heart attack and fix it as soon as possible and make them move as soon as possible. So what are all in that region, what are all the fractures which might happen is, one is neck of femur fracture can happen, or intertrochanteric fracture femur can happen. In those cases, then how to go further? Immediately you should get the patient to the hospital, to the orthopedic surgeon who will do the x-ray, and depending on the fracture, we will give you the treatment option. If it is a neck of femur fracture, we usually do hip replacement, either hemi hip replacement or total hip replacement. That depends on the physical capacity of the patient and also the surgeon's decision. And if it is an intertrochanteric fracture, we usually fix it with a nail and screws. So whatever the treatment options is, the main motto is to mobilize the patient as early as possible. Movement is life. When it comes to elderly, movement is life and rest is death. So we want them to mobilize early. The moment you come in, we'll evaluate, we'll post you for surgery, we'll fix the we'll do the necessary surgery which is required for that kind of fracture, and the next day itself we'll start mobilizing the patient. At least make them sit, make them stand, at least make them walk in the walker, and that's how we mobilize the patient as early as possible so that they come out of the death trap of being on bed and getting those clots or the pneumonia. That's how we do it. Okay, we have seen the surgical options, but before we go into surgery, prevention is always better. So what if you have a senior citizen at home, what are the checks you should have so that they will not end up in a hip fracture or end up in the death trap? So what are all the options you should think of? One, your bathroom should be slippery free. Not even bathroom, whichever room they stay in, that room should be, slip free. Tile should be there, or else the chappal he uses should be slip free. That is one thing you should take care of. And the room should be lit up very well. They should not be in a situation dim light or something wherein they'll put their feet somewhere and they'll slip and fall. So lighting should be good, and also the bed and the bed sheet rugs, which they should not be clumsy or stick to their leg and they fell off, right? So it should be very smooth and it should be taken care of well. And the most common thing is the vision test. They should have a regular eye checkup every 6 months and make sure they have a clear vision so that they walk properly in this thing. And one more thing is, you should check for the osteoporosis. There is something called DEXA scan. Get it done. Check whether he is in osteoporosis. If he is there, give the treatment as early as possible to reduce the osteoporosis, which will again reduce the risk of fracture. And also muscle strengthening. Even in elderly, they should do some activities of muscle strengthening, weight training, so that the more muscle strength, the bone indirectly becomes stronger, and even a minor fall will not let them go into hip fracture and into that death trap. So this is how you take care of your elderly at home. If you do that, the life will thank them and your senior citizens will thank you. Please take care of your elderly well, because they have taken care of you and made you big persons now what you are. Thank you.